Okay, I'd like to call the meeting for the neighbors of Dunn County to order. And looking at the roll, I think we have Don Keeter on the phone and we're just missing Sean Breslin. Other than that, we have a quorum. In the minutes from last time, I'd look for a motion to approve the minutes.
Also move.
Supervisor Bjork first and Supervisor Keeter second. Any discussion or corrections you see? All in favor?
Aye.
Okay, it's approved. At the request that there's no public comment. But would you like to introduce your staff and then they can go back to work?
Yes. In the past, Carmen has brought her management and her new people in to meet the board. And I thought, since today I do have all three of our billers in the office, we do have a work from home program, that I'd bring them down here and introduce them.
Well, thank you. That's a great idea.
Hey, so you want to come up or?
Yeah, if you want to go to
Yep,
one of the
one of the microphones?
In fact, you can all come up and
Yep.
sit at a spot.
Yep.
Yeah, great.
You have to press the red button on the right.
The right of the two buttons. There you go.
Okay. Hello, everyone. My name is Carol Hofferman, and I have worked with Dunn County for about 15 years now and been with the neighbors in finance for about 9. Nice to meet you.
Yeah, Carol, thank you. We are the benefit of you guys and Shane's work.
And Carol is our lead and started out in home health care
That's correct.
billing.
Yes, that's correct.
Oh. So you moved over from home health when that's not the one we're talking about that closed?
It
It
is,
is.
and I actually moved a little bit before then.
Okay,
I was with them for about 6.5 years.
okay,
Mhm.
great.
Yes.
No,
Just-
push it.
Just press it.
Once it's right around the circle.
There you go.
My name's Elizabeth and I just finished my first year here at Dunn County, so. And I do medical billing for the nursing home as well.
What's your background then? Where'd you come from?
I'm from Menominee and I graduated from CVTC in May of 2020. And then I worked at a health insurance company for about 6 months and then I came here. So.
All right, great place to work.
And we
Yeah.
are very lucky to have her.
My name is Ashley Faulkner and I have been with Dunn County it'll be 2 years this year in March for a medical biller, but I was also in 2014, a CNA for the neighbors as well.
You don't want to work part-time besides, do you? Weekends and-
No, not necessarily.
Oh, fantastic.
Yeah,
And let's see, you were in the old building then?
no, I actually did my CNA clinicals at the old building, but then I worked over there. I think it was open for a year or two before I started as a CNA over there.
Okay, okay. What a mixture of backgrounds and stuff. It's cool.
Yeah, I'm very lucky to have them and it's been enjoyable and I think we have a good staff and we're still in training. My thought is it takes 3 years to really get to know all the different ins and outs. So yes, that's who makes the money here.
And they're doing more than just the neighbors.
No, they are specifically just
Specifically
the neighbors, except Ashley and Lizzie, they do work at the front desk in the administration office. Part-time, that's where they toggle in and out as backup to Kim, who answers the phones. Our phone system works so well that they can answer the phone from home as if they're in the main office. So kudos to IT for that software.
Okay, well, gee, thank Jane. It's a great idea. Thanks for coming down and I'm glad you're able to all be here today.
Thank you.
And I note there is no one here for public comment. Was there any No other public comment. At the request of the chair is nothing this time, so we go right down to number 6, Community Mentor Administrator Report, please.
All right. So as always, we have the Quality Assurance Steering Committee updates. So the one thing that I'd like to share that's a little bit different this month that we've been working on is we are working through changing our master assignment sheets right now, which is the care plan that our staff that work directly with residents carry around with them. We're trying to make them more user-friendly, a little bit easier to find things on them. So we've been working on this project for a few months now, and it's kind of got into different steps, but hopefully we'll be implementing it next month. It should save staff time as well as have better outcomes for residents, as staff will have everything they need right in front of them instead of potentially having to go find an answer to a question they have about a resident. So making them user-friendly and a little bit better for everybody involved. So that's a big project we've been working on lately. Besides that, we did go over our regular quality assurance updates, our survey updates, things like that, and everything was pretty status quo from that. But that big project is one of the things that we've been working on that we're hoping to have implemented soon. Any questions about that?
With different people going and visiting the rooms or with quality assurance, I mean, is there a procedure as far as that everybody follows, that you greet the person, you check the whatever it is, is there stuff like that they do? I mean, is there a sheet of when you enter a room, what you're supposed to do?
There isn't a sheet, so that's actually taught as part of CNA training and nursing training, and then we also go over that in orientation. So when someone is entering a room, they always have to knock, no matter what, even if we don't know someone is in a room. So if we think the room is empty, we always still knock. Enter the room, you greet whoever is in there, say your name, say the purpose of why you're there. And then ask them, depending on why you're entering the room. So if you're going in to just do an every 2-hour check, which is the standard, you would check on them, do those different things. If they have their call light on, you would ask them what you can help them with and things like that. And then when you're completed with everything you're doing, you wash your hands, you ask them if there's anything else that you can do for them, and then leave and make sure you return the room back to how it was when you entered. So that's the standard, but we don't have a sheet that necessarily says that.
Thank you.
No problem. Any other questions on quality assurance? Okay, next is the employment activity report. So Chris, I believe, is on the call.
Oh, he's back.
Yes.
Hello,
Welcome back, Chris.
thank you, thank you. So go over the December 2022 employment activity. So types of recruitment remain pretty much the same. I did let the job service ad expire. However, we don't really get much bites from that one. So I do try to do that one a couple different times throughout the year. Were you raising your hand, Mike? I can't see my screen.
No, I'm sorry, I was not.
Oh, that's okay. Go on down to the interviews. So we did 6 direct hire interviews, 9 agency interviews. Positions offered were 6, positions accepted were 6, and that's just for in-house staff, and those are mostly for homemakers. I guess we did have maybe 1 or 2 CNAs that started in that group also. Nothing started higher than a step 3. That's typically nurses. As I've said before, we did not have any nurses start. Resignations, we had 6 resignations, and they're listed as below. The DON retired, Paula. We had a full-time newer RN. She had left for a job with St. Croix Hospice. Then a couple of part-time CNAs, they were on an extended leave and just didn't return any contact when I tried to reach out to them to find out, what the status of their leave was or anything. So they were just, basically their casual employment was just ended. And then a couple of part-time homemakers were high school students on the PM shift, just had some scheduling issues, a lot going on with extracurricular activities and needing to miss a lot. So they kind of took a step back and resigned for a bit. We go down to open positions. those were changed with the onboarding and offboarding pretty steadily. The numbers are active leave of absence. We have 7, majority of those are educational, school related. Go down to work comp, lost hours, again, another month that we did not have any lost time injuries, which is great. And then we go down to the tally of the COVID-19 missed shifts. 97 shifts are roughly 207 hours, which includes missed hours of agency staff, because those again are open shifts that need to be filled by someone. So I do take those into account. So anybody have any questions on my run through?
Anybody else?
Yeah, I
Carly?
was gonna question, are the employees that, or CNAs, I guess, I'm not sure if it's employees or CNAs, but employees that were suspended, have they been put back to work?
Who was, I mean.
I'd heard that there was some suspended and on leave of absence or whatever, and so I was just wondering if those people have gone back to work.
If they were on leave of absence, there, typically how that runs is we have a lot of students. So they do come back for like the winter break or Thanksgiving break, and then generally leave again. Is how it goes.
Okay, thank you.
Yep.
There's, Don, did you have any questions?
No, not right now. Thank you.
This is where I generally ask about the CNA course.
So I actually had some correspondence with the company this week about this. The one thing that we're working through right now is the state has changed their requirements for the training center, like where we actually do the training. So we're trying to kind of negotiate with, basically, they have an issue with the fact that where we would do the training is in a licensed area. So it's within a household. Right now, we don't have any residents in that household, but we are licensed in the way that we could put residents in that household. And they have a problem with the classroom that we use being in a resident area, thinking that we would have staff or trainees be coming in and out through a resident area. So working on a way to, without having to do any construction, have that, because it's at the end of a hallway, there's a separate entrance there that we could change to make it not an alarmed entrance and things like that, and trying to the area of where the training is the current issue. So working through that, just because they did change their standards for that, as that was the area we had used in the past.
Okay, so, and that was the problem that you indicated last time.
Yep,
So you're
so
kind
we're
of working
moving
on.
forward. Yep.
Okay, I have a question. I've been seeing on TV advertisements from the state, a consortium of things. And what's the one that represents the nursing homes that we work with?
Leading Age Wisconsin.
Leading Age Wisconsin. They're advertising CNAs saying we will pay $800, or we'll pay your fees and everything else like that. What is that?
So that's part of the WIS caregiver program. So we are members of that program. It is a program that they help pay the CNA training fee for the trainee, as well as then they partner with nursing homes so that then when this trainee then becomes a CNA, they stay with the nursing home for a certain amount of time, and then they get that bonus. We did this a couple of years ago. I believe we had 3 or 4 people that came through that program. It was probably in 2018 or 19 that we had that. The state just re-upped that program. So we are still members of that. We haven't had anyone apply through that yet. But basically we are partners with the state to have people come through that program.
So they are, the state and the consortium is advertising for everybody.
Everybody.
basically.
Yep.
And do we piggyback on that somehow?
Yep. So it is on all of our recruitment stuff that we're WIS caregiver people. So if someone is looking for that program, we are part of it. As well as we come up on all of the lists for them. So when someone, when someone applies for that program, they get a list of nursing homes in their area, and we're on that list. So yes, we do have that through our stuff.
Where are we in the clinical mentor position? advertising? Paula's,
Yep.
okay.
So it is actively advertised at this point. We have not had qualified applicants.
Okay, thank you.
Mhm.
And as long as we're on employment, can I ask one further question that's more detailed?
Sure.
Homemakers, I was in a room the other day and the resident called and a homemaker responded.
Yep.
They do everything, huh?
So they can't provide any actual resident care, but we do expect anybody to answer a call light because 9 out of 10 times the resident needs something pretty simple that anybody can do. And then if they can't do it, they would find someone who can. So anyone walking through a hallway that sees a call light answers it to see what the resident needs and then finds who can help them. But I mean, anybody can grab a remote, grab a glass of water, grab something for a resident. So, and that's mostly what our residents put their call lights on for. And then if they need help, say using the restroom or something that a homemaker can't do, then the homemaker would go find a CNA.
Oh,
Mhm.
so they don't have to walk all the way down the hall and answer a light when there's somebody right next to the room.
Correct.
Okay. Any other? Yes.
I had a question on the homemakers or the high school students. I mean, people do a lot of looking around, deciding what they want to do.
Mhm.
And let's say, for example, someone says, I really think I'd like the CNA program.
Mhm.
And they go through it. And is there financial assistance for achieving the coursework?
That's through the WIS caregiver program. Yes.
Okay,
Mhm.
so they do that and they get in the program and they go to work for us or somebody else.
Mhm.
And they're saying, I don't know if I really like this. I want to try working out at a warehouse. And so they say, well, I'm just going to cut ties now and go try something different. Is there a time period on if they've been trained as a CNA, where if they go experiment with another job, that they can come back and work as a CNA?
Yeah. So as long as they keep their CNA certification up to date, which is annual recertification that we have to submit for people. But I believe it's actually 2 years that it goes out for, but we have to submit that they worked a minimum of 8 hours within a year as a CNA, as well as completed a number of training hours. Their certification keeps up. So as long as they're on the CNA registry, we are able to have them so they could come back. Mhm.
And then the other thing would be in the same situation where somebody is working for the county for a period of time, let's say a year.
Mhm.
And they say, I gotta, families moved, family things have changed, or I want to try something different. And they leave our employment. When they come back, is there any residual benefits that, well, you've already been with us for a year, so now you start at a different level or, I mean, is there anything? What I guess basically is how easy is it for people to leave and come back? And what do they gain or lose anything?
Sure. I can't speak necessarily to like WRS or some of the more benefit things. That would be more of an HR question, but in terms of wages and things like that, we do put into consideration their past experience with us and things like that when setting wages. So we don't always put them exactly where they would be if they had never left, because there's obviously the gap there. But we don't start them off at the lowest wage kind of thing and work their way. They don't start back at the beginning for wages, but in terms of WRS and stuff, I'm not sure on the rules on that.
For the retirement system, WRS, they just keep their benefits in there. After like 3 years, they can take them out, but it's not too smart to take them out. But so they can keep them in there and come back 10 years later if they want. That'll be waiting for them.
What's it called?
Wisconsin retirement system. It's for
Okay.
teachers, police officers, anybody, people working for the library, anybody working for the state
Got it.
indirectly.
Thank you, Mike.
That is one thing I know a lot about is retirement.
Now, why would that be? Oh, your wife retired.
Yeah, that's it. Okay, so that's employment activity report. Anything else? Don?
I was just wondering, with this training program for CNA, is that more of a logistical part right now, or will it cost more if the trainers do what they want to?
It's logistical right now of being certified for it. So we have to be certified by the state to have it in our facility. So we're working on that process right now. In terms of training and stuff, right now we're working with a different company that would provide the trainers. So we would not be having to find a trainer, but it's more logistical of being certified.
Thank you.
Let's go on to 6C then, resident referral report.
Okay. So in your packet is a resident referral report. We had 97 residents at the beginning of the month. We had 87 referrals, which is a little bit down from what we have been seeing in the mid 100s. And then we had 6 residents admitted, 83 not admitted. We're still not admitting due to staffing, so we still have 2 households closed. We are admitting to the open beds in the other households. We do have enough staff to staff the 7 that are open. So if we have someone discharge or pass away and we have an open room, we are admitting to those rooms to kind of keep a par level. At the end of the month, we did have 97 residents, so we're staying right around the 100 mark. We had 2 residents transfer to other facilities to either, we had 1 resident transfer to a facility in Eau Claire to be closer to family, and another resident transfer to another facility in a different area as well. We had 4 discharge home. And had 2 deaths this month. The referral sources are the same as our normal referral sources. We have seen less of the referrals coming from scattered across the Midwest. So we're thinking that more hospitals aren't getting as pressured to send to further places. I'm not really sure on that one, as it kind of comes and goes, but we have had a little bit less referrals this month in comparison to other months in recent history. Any questions on the referral report?
Any questions, anyone?
No.
Okay, thank you. Let's move on then to D. Scott.
Good morning, everyone. I guess the big update, we have a Dunn County custodian now, as we had in the plans of moving our express custodians into actual Dunn County employees. At the neighbors, Cindy Mailing started January 1st as a Dunn County custodian. She's part-time, works 4 days 1 week, 3 days the next week. And I'm currently recruiting for the second custodian position over there, going through the applications right now. So I'll be able to get through those and set up some interviews and get someone hired for that position. So we'll have 2 custodians over there. Aside from that, our other thing that Carmen has on the agenda is a central survey. So I'll report on my portion of that. The life safety code got 0 sites. So it was a exciting time for us, for Brady, for Bob over there, and the rest of the facilities team. My other guys do help out over there as far as taking on call or helping out whenever they need an extra hand or have something come up where they need more people or more technical knowledge. Brady is doing a great job over there. All of his paperwork is up to date and very well organized, makes it go real smooth with the state engineer when he comes in. He can go through the book and right down the line, everything is right there for him. When we did the walkthrough, everything went well with that. 2 houses, of course, are closed down, but we still go through those. Engineer goes through and looks at everything as if that house was up and running with residents, checks doors for opening, closing, all that stuff. Just like if it was up and running. So it's still a full survey like normal. So everything went well on that. Aside from that, the staff have been working on their typical work orders, taking care of things there, snow and ice removal, and any equipment repairs. Things have been going, I'll knock on wood, fairly smooth. They've all been doing a great job. Any questions?
Don, any questions?
No, okay, yeah, no.
I did see just the bottom half of one of your employees. I don't know which one it was, Brady or Bob, in the ceiling the
Yeah,
other day. So they're around. They're always friendly too.
good.
So is your other custodian part-time?
Wait, would push your button.
So is your other custodian that you're interviewing, is that part-time? or-
Yes, that's also part-time. That'll be, so what it is that Cindy works. Say like this week, if she works 4 days, then next week she would work 3 days. So it'd be this week would be a Monday through Thursday, next week would be a Wednesday to Friday. Then the second custodian position would be opposite. It'd be Wednesday to Thursday or Wednesday to Friday this week, Monday to Thursday next week.
Okay, thanks.
So they switch back and forth.
Thanks.
Yeah.
I got a question.
Larry?
Scott, I happened to have the opportunity to do a little tour the other day, and I guess I was just really impressed that the environmental feel of the whole thing. I mean, as far as the air felt fresh, it felt clean, it felt warm. You know what I mean? How some buildings don't come around, but those buildings felt really good that I was in. So my question goes back to then, are they heated and cooled from the central location from that? Or each building has its own HVAC, whatever it is.
Each building has its own HVAC system off the geothermal system.
Okay, so
Yep.
it pulls from the geothermal, it will take what heat? The geothermal will provide heat is that right? And then,
The geothermal provides heat from the ground in the wintertime, also provides cooling in the summertime. Then each of the houses has their own ERVs. They are air handlers basically that bring in fresh outside air and exhaust the stale inside air to keep the air fresh.
right,
So there's a certain amount of outside air that comes in, and then there's the stale air is exhausted. So you have a turnover air to keep it fresher in there.
right.
Yep.
It felt really good.
Good, good.
And then, is the temperature in the rooms, are they regulated individually at all?
Yes.
Or, okay. Wow. pretty
Yes,
nifty.
each room, resident room has a heat pump in the ceiling outside of the room, and that is ducted into that room, and they have their own thermostat in each room.
Right. Because my heat needs are not the same as my wife's. So of course, I'm the one that puts the wood on the stove at the farm and she doesn't. So Larry, have you done wood? Yeah, okay, never mind. But I've been really aware of environmental
Sure.
stuff because I'm quizzed all the time.
Sure.
You know. Okay,
Thanks for bringing that up because we are lucky. Our facility that we have, we just went through with a brother-in-law, the purchase of where he lives, a nursing home, the decimation of the nursing home, then the sale of the nursing home, and then spreading the people out to other nursing homes in the neighborhood if they can find them. And the nursing home he's in now is way better, but nothing like we have here. This is just, you walk in, you don't know you're in a nursing home as far as any kind of odor or ambiance or anything. So thanks for bringing that up. Scott, is that it?
That's all I have for you.
Don, any questions?
No,
Okay, then let's move on.
All right, next on the agenda is the central survey. So their central neighborhood had our annual survey, as Scott mentioned, last week. So they showed up on Tuesday for our annual survey, as well as it did have some complaints along with it. When the surveyors showed up, they said they are very behind on following up on complaints. So anytime there's a complaint about a nursing home, the surveyors are required to come to the nursing home and investigate just that complaint. Normally, If there's one that's really close to an annual survey, they'll just lump them together. They actually lumped them together since our last survey. So we had a complaint survey that was all the way back to July that showed up with our annual. So they are very behind because normally those are done within a couple months of the actual complaint being filed. So we had a briefer survey than normal. It was only 2 days, but there was 4 surveyors for 16 residents since this is our neighborhood that has a very low census. They sent the amount of surveyors that they would need if we were full at 46. So it went a lot quicker than normal since there was only 16 people to review. So they are there for 2 days. We were citation free and the complaint surveys were unsubstantiated. So for reference, the state average is, I believe it's currently around 7 sites per survey and the national average is above 8 sites per survey. So we had citation free for both health and life safety code, which to my knowledge, we've never had both at the same time before. So it was a really good outcome for our survey.
Any comments or questions, Don?
Yeah, I'd just like to thank everybody on the staff for the good work we do. Because that's really important that your complaints stay down, and then of course a lot of them are substantiated anyway. And the ratings we get are really commendable. So thank you.
Anyone else? Thank you, Don. Just a question. All these zeros and ones, are we getting it out there? How are you saying, look at us?
Yeah, so we do have, so it is on Medicare's website. That's it's the first factor of the 5-star rating. So we do have that out there as you can, whenever you go to look for a nursing home, it comes up right away that we have 5 out of 5 stars, as well as the first thing on that is health inspection. So when you go to that, you can see that you can click on it and it shows 0 citations, and it is right on the top. We have not, we do advertise that we're a 5-star facility, and that's the biggest part of it. I guess we haven't put out any specific advertisement of a citation-free survey, but we could do that.
Well, I've been thinking that Chris Corpola has really been going out and engaging the public more with her videos and so forth. If you talk with her frequently, so connect with her and perhaps incorporate that in there, because it's not just people looking for a nursing home.
Mhm.
It's the taxpayers supporting the nursing home.
Yep.
And it's important that they see what we've got. So I would really recommend that you talk with Chris and Chris Corpola.
Yep.
And
She's
that
actually
Chris.
on here, so
Oh.
that's perfect.
Good. We'll lay everything at Chris's feet too. But that we just need to get that out. It's wonderful.
She just put in the chat that we can highlight the great news.
Okay. Thank you, Chris.
Any other questions on survey?
No, let's move on then.
Okay. COVID-19 update. So I've kept this on here. Nothing too new to share for COVID updates. Besides that, we have had a couple of COVID positive staff over the past couple of weeks, but fortunately we haven't had any COVID positive residents at this time. So that's a very good news. Our COVID numbers in our county have gone down for transmission, which is what we look at for our policies and procedures and things. Unfortunately, they keep fluctuating, so it's hard to say that they're down, and the counties surrounding us are up. So it would be great if the border just stopped at the county and we didn't have to worry about next to us, but the surrounding counties around us have higher rates right now too. So we keep an eye on that at all times, working with public health and state health and infection preventionists as well. So, but fortunately we haven't had residents positive recently, so that is good news.
And flu?
We have not had any flu.
Wow.
We have anytime now that we have anyone that has flu-like symptoms, we do test them for both influenza, COVID, and RSV, actually, just to make sure. We've been so heightened focused on COVID for 3 years, but we also now are making sure that we're testing for all things, because if they test negative for COVID, it might be something else. So we work through that process with having all three current respiratory illnesses tested for.
Any questions, Don?
No, not, thank you.
Anyone else? Okay, then I think, are we down to number 7 then?
Yep, unless
Jane?
anyone has any other questions for me. Oh, all right.
Okay, the vouchers, were those sent out? I haven't gotten a copy of those, but any questions on the vouchers?
Questions on the vouchers, Don?
Oh, thank you. No.
Okay. Then I think if we start with the pool staff chart. Not that I'm not going to be full of rosy information this meeting, since it's year end and it's been a tough year. The pool staff numbers have been updated for year end. So in January, things look good because we haven't posted the January stuff until February. So December is also a catch-up month to get current with the entire year. So we'll see the year-end results in the box kind of in the center of the page, central lower. The total agency staff cost for the year was $5,333,000, which is higher than last year by almost 300%. Our census was down 20% almost. So you can see where that imbalance has started, or where it is. 2021, we didn't have a whole lot of, we had lower agency costs than in 2020. So in 2022, it really hit us hard with the COVID and the shortage of staff. And then, of course, supply and demand and the cost goes up. And I believe all the invoices have been paid for 2022 agency staff. They like to get their invoices paid pretty quickly. So there might be some miscellaneous things added to this, some little ones, but I don't see that number changing much before the year end closes. Any questions on the agency staff
Questions
costs?
on staff, Don?
No. Well, one thing I was wondering, maybe I didn't hear it correctly, but I know my first years on the county board, there was some complaints from various circles that we were paying our people too much, and that's why we were in the hole all the time, so to speak. Anyway, that was the argument, and I, of course, didn't agree with that, because I think if you pay people well, then you get good care too, and that balances out in our complaint department. But I was wondering if that has closed any, or if we still have pretty good pay schedules and benefit schedules compared to other nursing homes.
I can speak on that a little bit. Compared to other nursing homes, our rate of pay is very competitive with them. Our biggest competitor, though, is actually not other nursing homes, it's other healthcare entities, because hospitals, clinics, and things like that also do pay or hire CNAs and nurses. So we do have a biggest competitor of probably being Mayo in town here, which their nurses' wages are significantly higher than ours. That is something that HR, myself, and Chris have been working on, as our CNAs are pretty comparably paid compared to theirs, but our nurses are paid less. It is a different job working in a nursing home versus a hospital, but they are paid more than our nurses are currently.
Does that answer your question, Don?
Yep. Yeah, thank you.
Let's continue on then.
Okay, any other questions about the pool staff? No, okay. Then going on to the aging report. And I will work on getting that to be more readable, because mine, when I print it, is actually a little fuzzy. we do have a little bit higher outstanding balance at the year end. The Medicaid rate adjustments have been posted to our software, which means we are posting the revenue, but we haven't gotten the money in yet. So that shows in the aging. Medicaid will reprocess those claims in due time, going back to July. Central had quite an increase. East and West Medicaid rates went up somewhat. We are appealing those rates to the state based on what we consider an error in one of the calculations. So that would end up being about $115,000 difference total. If you multiply that difference times the number of Medicaid days that we've billed, so that's about what we're looking at. There's another $100,000 with that appeal. We've had to reprocess a few claims with Medicare A. They have a new system that we're catching up to of paying claims timely. They have to be spaced between the one claim and the next claim, otherwise the payment is off. So we're reprocessing some of those. So those end up being in the aging as well when we're in between canceling and reclaiming. Any questions on the aging?
Question. So if we build it, but we haven't received the money yet, and we look at the balance, the big balance sheet here, it's not included in there as revenue yet, then is that correct?
We do include it all as revenue because we have a different accounting system as an enterprise fund than the rest of the county. We post our revenues as we book them.
Okay,
So if in December, we say we build out, not that we've billed out physically, but we know we have, say, 300 Medicare days. We're going to calculate that in the software and put that on this aging report, and it'll pop out, even though we haven't been paid. And the co-insurance hasn't been paid and such. We do put the revenue down here as we book it, as we earn it.
thank you.
Yep.
Don, any questions?
I'm good, thanks.
I keep asking you, that's partly to make sure you're still there.
Yeah, that's fine. No, I
Okay.
haven't gone to sleep yet anyway.
Okay. Okay,
If we go next to the campus census, you'll see that's down in all categories. The private pay is especially low. We're way off on that compared to what we budgeted. Private pay continues to be a lesser group of people in our buildings. Maybe because the price of skilled nursing is going higher, they run out of money faster, or they stay in assisted living longer and then come to us when they're more acute. But the nature of who comes to the skilled nursing homes is changing as well.
I can add one thing there. I don't expect that to change going forward. In general societal economical terms, there's less people that have the funds to pay for nursing homes by the time they get to nursing homes. Just roughly speaking, a stay in a nursing home for 1 month is $8,000 just for room and board. So that's a hefty amount of money, and there's very few people that have that amount of money saved up. And I can just see that becoming less and less people as time goes on, just economically speaking. So I don't see that changing in years to come either.
Another change on the landscape may be the veterans contract. Every county has one veterans contract. I should say the veterans only contract with one facility per county. There is a new program being rolled out where other homes can bill for veterans benefits based on this other insurance company that is helping increase the healthcare available to veterans. So that might be some competition for us in the future. It's great for veterans to have more choices. But again, our contract won't be the only one in the county. If they are able to get access to care somewhere else.
I ask you, so are you getting more veterans? Is that staying about the same there at the nursing home?
We currently have a fairly high veterans census. It's really sporadic, so we don't accept someone yes or no based on that. But if someone's accepted to us and that's their payer source, so it's kind of hit or miss on how many we have. But we do have quite a few right now, more than we've had in the past.
Thank
Mhm.
you.
I think we have a good relationship with how we admit people through the veterans, the social workers. They know who to call. It's not a hiccup anywhere. It's a regular process. So I think it's easy for us to admit the veterans if
We
they
did-
qualify for that particular benefit.
Yeah, and we did also just re-sign our contract with the Veterans Administration, so they're on 5-year contracts. So we just had that in November, basically to start this in December for the new contract. So we have different rates for them as well, and just re-signed a 5-year contract with VA.
So their level of care, like their disabled bed, is that vary a lot there too at the nursing home, like what they can do for themselves or, do they need a lot of help or where, you know what I'm trying to say? As far as their limits and what veterans to come to you as what's.
The rate that is paid by veterans is based on their acuity.
Mhm.
So
Okay.
it's score based. It's not, one size fits all, one rate for everybody. So if a if a veteran needs more care, it's a higher reimbursement.
Okay.
Okay, then on to the financials. If we go to that cover page, the income statement. Well, let's start at the top with the revenues. The revenues compared to budget is down $500,000 from what we budgeted. If we go into the detail, you look at private pay, that's down by $361,000. Medicaid revenue is down, Medicare A revenue is down. Basically because the census is down and staffing has limited our ability to get people in the door. Senior Meals is doing fine, and we did post the $307,000 of provider relief funds last month, so that is now included in our revenues. The miscellaneous revenues of $35,000 includes an insurance rebate that the county received due to COVID that was posted in, I think, last January, and then it was posted to each department. So we all got our share of that refund. There's land rent in there, some rebates and refunds. So the net is $441,000 off from what we had budgeted, with a total revenue of the 14.2. Go on to expenses. The nursing services is not a surprise, but it's over $1 million higher than what we had budgeted. And when you look at the census of being down, that's it multiplies to a bigger percentage increase. Other things to note would be social services. We had budgeted for 3 social workers for 3 homes, 3 buildings being open. We only had 2, so that helped the budget. And Carmen manages those, and I don't know what you're planning on for the next year, but probably not to increase social workers if the census doesn't change, I would imagine. The dietary, when you look at that, they are under budget, but only by 10%. And if we served 20% less people, that means our food costs went up per person. So I would expect that to continue through the next year. Property ownership and use is in line. And then we go down to senior meals being over budget, but then we had more revenue, so that balances just fine. Operations of maintenance and plant is a little bit out of whack there. So our heat and lights, natural gas is higher than anticipated. And I'm going to look further into those specific bills because I'm not sure if it was undue cold in one of the seasons or too hot compared to what we had budgeted, or if there's an error. So that one, stay tuned on that $80,000. So I'm not quite sure why. There's more to that, I think, that maybe we can reduce. And there's some contractual charges in there as well. And there's also in there the assets. We now track our assets a little bit better. There's bariatric types of equipment that we can get a credit on through our Medicaid cost report, but they have to be tracked differently in our SAP system as assets that depreciate. So right now they're in that category, but they will come out of that category. That's about $20,000.
They're in which category?
The operations and maintenance of plant. I'm working through some SAP transactions, and for the moment, they're stuck right there.
Excuse me, what is your MDS? Is that like supplies?
MDS is minimum data set. That is part of the nursing department. It is pulled out because it's kind of its own thing. We had the MDS nurses come and introduce themselves one day. That's how our rates get set. It is basically the score. They're scoring all of the residents' needs.
Okay, thanks.
If for 2023, we budgeted them within the nursing services. So that won't be pulled out separately in 2023. Because they are direct care services. As far as reporting goes, there's no real need to have them pulled out for that. So we're combining those. And therapy bills are pretty much on target as a net item. We did not put in the base trim this year. At least I don't see a charge for it. I'm not sure if that's for next year or we keep budgeting for it and not sure if it gets put in, but that's one capital expense. And then I think in a month or two, we'll be talking about capital expenses again for the following years. Is that right? Beata's starting to talk about that as the next big financial project.
And the big one for this coming year, so it was budgeted for 2023, is the bus purchase. So that is something we've been working on because it is about half a bus is budgeted in capital expense, and then the other half would be paid for through the fundraising, which we are up to, I believe, $63,000 fundraising right now.
And also, speaking of fundraising, we did move the money out of the nursing home revenues into deferred revenue. If you look at month-to-date revenue, the miscellaneous revenues, you'll see some negative numbers there. The negative 33,480 as revenues. That's the money moving into the balance sheet account. So it's moving it from 2022 into the 2023 numbers. So we don't include the money that we're saving for next year for the bus. So at the very bottom, we have a net loss of $1.4 million this year. That's with the depreciation. Without the depreciation, there's a net loss of $758,000. Last year, we did put $1.3 million back into the general fund due to the provider relief funds. We posted most of that last year. And if you average the provider relief funds that went back to the county last year and this year, I think we're still up as far as revenue and losses go between those 2 years. What's to think about then would be 2023. How do we go forward without provider relief funds to backfill? Any questions?
Yeah, Larry?
I have a hard time putting my head around all the different things. But, you know, one thing that's, you know, stands out for me is that we have facilities that are not being used because of staffing. We have a census that could be higher, and we've had quite a few turnaways for whatever reason. And it all seems to hinge on this pool help and what we can afford for pool help and what we can't afford for pool help. So are Dunn County residents kind of being held hostage to their own facilities? Just like if you didn't plow snow, you know, it would raise a lot of concern. And I hear how the state has now up their projections for $6 or $7 million billion in what's the term? It's, you know, that surplus. So doesn't the state have a responsibility to help county facilities? You know, Mayo can do what they need to do to adjust what they can pay their nurses and staff, doctors. But little old Dunn County, I mean, we're just, you know, I think we're being robbed by these pool organizations that provide staffing, and who oversees them and what they. So I don't know if, like I said, I have a hard time putting my head around this, but it's just. When you see what a nice facility Dunn County has, and you see the need that people would like to not admitted for whatever reason. And we can't do the job because we can't afford to pay the price that it takes to have staff people in. Doesn't the state have a responsibility to help out their counties? I mean, are we we're not the only county nursing home, are we?
There's, I believe that there's 33 county nursing homes roughly. I'm not sure if that's the exact number, but there's in the 30s of.
I mean,
County
a
nursing
while
homes.
ago, you know, a year or two ago, we talked about where Wisconsin was as far as the Medicare reimbursement at being at 50. And some noise was raised about that, and we're not 50 anymore. So, I mean, I think there needs to be some noise raised with the legislature that you have collected all these taxes. You have collected all these taxes from Dunn County and Wisconsin residents. And Dunn County has a problem, and probably other nursing homes have a problem, in that they can't compete with the privates. So whose responsibility is it isn't it the state's responsibility to help out the counties so that they can compete with the privates? I mean, who carries the big stick here?
So I can answer a little bit. That is on our legislative agenda, is continuing increases. So, and it has never been taken off. So that is on our legislative agenda as a county, and will be discussed with the legislators. I believe that's in 2 weeks on Monday. So that is something that there definitely is still noise being made about it, both by the counties, the county associations, and by the not-for-profit nursing home associations in the state. So it's definitely hasn't stopped advocacy for even higher increases.
Yeah, and it's the supply and demand thing nationwide. There's a shortage of the staffing. So that's a national issue, and the state has, I think, increased funding for the training programs, and they do what they can to help the economic development of the staffing for that industry. And yeah, but it's legislatively, yet they control the Medicaid rates and the supplemental payment is a big item too, I think in the next year, when they get their calculations refreshed. Hopefully we regain what we budgeted for the supplemental payment as well. And that's what the state does provide the county nursing homes in exchange for our expenses that are higher than the private nursing homes, where we have corporation counsel that we have, we share that throughout the whole county instead of hiring our private separate attorney like a private home would. So there are other costs involved in being a county home. Through the supplemental payment, they do reimburse us, but that's also an issue to not forget about. That calculation is currently pending,
Still pending.
still pending.
Am I right now, the over $5 million that we spent on pool, most of it for CNAs, even if we took that money and said, we're going to pay CNAs, we couldn't find the people?
We'd be able to find some, we would not be able to find the number that we would need, not enough to replace the amount of pool help that we have.
And that's just crazy, isn't it? Because that's a lot of money.
Yeah.
I have a question. Any other questions on the income statement? Don, how about you?
I'm good.
Okay.
It's always difficult to look at that, but and I agree with we need to get the state more involved, but they come to our legislative meetings and say, yes, we'll do something, and then really not much happens. So we just have to keep plugging away, I guess.
Okay, just one simple question up there in property ownership use, Jane. What's the asterisk for? I'm looking for something down
Oh, the
on
asterisk.
the left. Yeah, way on the left, property ownership use.
Yep, that is the depreciation.
That's what
That includes the depreciation, yes.
that's what the asterisk means. Okay.
It used to, the asterisk used to be connected to the accrued, the depreciation that hadn't yet been posted because we hadn't closed the period in our software.
But now you're doing it a little differently, so it's easier to understand.
Mhm.
Yes, and I thank you for that. And are you still putting all this information in by hand from SAP to this spreadsheet?
Yep, the actuals are put in manually and then the rest calculates out. Next month being the review of what we would usually do January, but there's no real January to forecast on. The rest of the county committees through Beata are focused on projecting for the year end. And I'll present maybe a comparison of Beata's new projection sheets for the year end versus our income statement. And hopefully next month we can talk about what information you want going forward to compare what you're interested in so that I can present what you want to know.
And hopefully in a little easier way to do it than rather putting in every single number every single month. You can just drag it in from SAP perhaps?
Yep, what happens is the CFO Beata will pull all that data into all the spreadsheets at once. And then each department goes in and updates and looks at their spreadsheets and sees, if, they need to adjust their forecasting for the year end. And then the county as a whole, she can see what they're projecting to have left over at the end of the year. So like in October, if all the departments are having an excess, she'll know, oh, we have this excess, we can, plan for that. Where NDC as an enterprise fund has been focused more on the income statement, not just looking at the year-end numbers within budget compared to budget, but you want to know the revenues versus the expenses as our history. So next month, I hope to bring both sets of data and you can see how you decide what you want and then we can format it that way.
Yeah, and we'll look forward to your assistance too, as you're the professional on this and what things we want to know, what things we should know.
Mhm.
So Thank you. That's great. Anything else, Jane?
I don't have anything else at this time.
Anyone else? Don?
No, I don't have anything. Thank you.
Okay, then. I guess we would take action, review of vouchers, and financial reports. I would take a motion to accept the financial reports.
I so move.
I'll second.
Okay, Corley moved and Don seconded. Any other discussion? All in favor?
Aye.
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 Any opposed? Thank you. Our next meeting date and time is,
February 23rd.
and it's still working out for you and the committees you're on and so
Yep.
forth,
Yep.
and for the
Yep.
for your work, okay.
Yep, it should be good.
23rd, the 9th, and we have an announcement to remind you on the 7th. Culver's has a fundraiser for the bus. If you go to dinner there, 10% of it, I think.
Yep.
Goes towards the bus,
What's the date again, Mike?
February 7th.
And it has to be for dinner, so it's from 5 to 7 PM, I believe. So lunchtime doesn't count.
It's amazing how far they've come for the fundraising.
Yes, we recently got a grant for $5,000 that we had applied for last year and were told we weren't going to get it because they had already slotted all of the money. And then they just said, well, we'll hold on to your application. And then at the beginning of this year, we got a check in the mail that we weren't expecting. So that was exciting. So we're really, well, we're past the point that we need to be at compared to what we've had budgeted. But if we keep fundraising and can spend less of the budgeted money and more of fundraising money, that'll be great. So we'll keep fundraising until we actually get to the point of purchase. And
So when you get this bus,
Thank you.
forget about it. So when you get your bus, will that be fully with the lift and everything on it?
Yes.
It'll be fully decked, which you need it for.
correct. Yep.
Okay.
So, and that's kind of all of what the average costs that we were anticipating it being was somewhere between 70 to $100,000. So that's why we budgeted about half of a bus of $45,000, and that's fully equipped. The only thing that we didn't calculate into that number, so it's good we have a little bit extra for fundraising, is decals for the bus that say the neighbors of Dunn County on them and things like that. But the cost of the bus itself includes the lift, any of the like hookups and tie downs and different things that the bus needs to be handicap accessible.
How many will it hold?
I believe our current bus holds 11, and I think that's what we're looking at, the same size bus.
Okay.
We can't go any larger than that as we don't have, the people driving it don't have CDL
I was
license.
gonna ask about
Mhm.
that. Okay.
So if we went any larger, we wouldn't be able to have the same people driving.
Mhm.
Otherwise, our activities staff would have to get CDLs, which I don't think they're interested in
Yeah.
doing.
Don't blame them.
If I could add one update, I don't know if it could have been under Scott's, but it's kind of an IT thing as well. There was one improvement made this year, and it just got hooked up, the internet from the building to the neighbors had been on a rental contract, and now it is, we put our own fiber optic lines in and connected those. So that will be a decrease in cost going forward because of that fiber optic line being owned by us now instead of rented. Did I say that right, Scott? Is that kind of the right word?
So it's going in. It's gotta go in or?
It's
here?
done.
already
It's
in.
done.
Yeah, it's been placed. It's a fiber optic line that goes from the government center over to the
How much
neighbors.
did you say you're saving?
I don't know the number off the top of my head, but it was a initial cost to actually have it put in, but I believe it was within 3 years, it would be completely paid off
Yeah.
based on our
Yep.
rental. So
Yep.
the rental cost was a third of the overall cost. So within 3 years, it pays for itself.
Yep.
Anybody else? Anything? And thank you, everybody, for being here and sticking around, Scott and Jane, and you have to. And for coming on a cold day. We are adjourned.